Hello, my name is Alex Garcia. I'm a P1 pharmacy student here with the U of A. I did my rotation with TMC in their ED station in the level 2 trauma center. I did my whole rotation in just one sitting with my preceptor named Brianna Ingersoll. So when I got there, they're already in their night duties, and I started from 4 p.m. till 8 p.m. with them, or like, yeah, I did my full 4 hours with them all at once. But when I got there, they're already doing their night duties. But I kind of asked and just try to gather some, you know, I try to gather some insight what their day-to-day activities and duties look like. Um, but their typical day to start their day, like when Brandon would get there, she told me they would do a quick debrief and they run new cultures on new patients and all that. And after that, they would go through all those chartings and cultures and just make sure that they check for anything that's unfamiliar that they see in the results. Pretty much what we do in Dr. Kennedy's 816 course. Um, but they would go through everything, make sure nothing looks unusual. They would check like the lab work. They would make sure they check any underlying health conditions the patient has. They would check, adverse side effects that the patient may have had. They check the medications the patient's on. But yeah, they go through everything and they go ahead and assess what they think is going on. But then they also go ahead and recommend and plan going forward what their best recommendation is for like a prescription or treatment plan, like when they release and discharge the patient. I think it's really cool. I thought the preceptor that I was shadowing, she also thought it was she loves her job with TMC, and she also did tell me that she would, after she would finish her schooling and all that, if it was something like an opportunity that would arise, that she would definitely jump onto it and maybe pursue this. But it does require 1 to 2 years of residency to get into this. Like a lot of hospital jobs or just a lot of specialty jobs, you'll have to do 1 to 2 years of residence once you graduate. But the student told me though, when she works, that she likes her staff, like for the most part, or not for the most part. She likes her staff here. She doesn't seem like she's overwhelmed. They work with her. It's flexible hours. She does work a lot though. She works from 12 to 8:30 Monday through Friday. So I guess as fourth year students, we kind of have to already kind of think about that like going forward. She is also doing a project that's kind of like, it kind of sounded nice too. Like what she was working on, she was telling me that she's doing a project on Tylenol and the applications in a real life setting of like people who have overdosed on Tylenol, and how she can apply that in an actual clinical a clinical setting, how to try to avoid this in an everyday manner. But she did have a recommendation for me though. She pretty much told me like us as students not to stress, or not to stress too much. We're all gonna graduate one day or another. Just don't procrastinate and enjoy it, since we only get one opportunity to kind of take advantage of learning, and this opportunity to kind of make connections and all that too. So just enjoy it, don't procrastinate, and don't stress too much. But yeah, that's pretty much it though.